Dr. Bhatti, thank you for having me on your channel. Before I answer your question, I want to address some concerns from my viewers. And that is, am I receiving any kind of benefit for these videos? Is it promotional in nature? And the answer is no, I'm not receiving any money, I'm not getting any free surgery. I simply enjoy collaborating with individuals like yourself who provide highly informative and ethical content for the hair loss community.
Hi, this is Dr. Bhatti, and today we are going to listen to an experience of hair transplant from a past patient who has got multiple surgeries done from various centers around the globe. Though doctors have an extensive experience, an extensive knowledge born out of institutionalized training, knowledge that is verifiable, scientifically verifiable, along with a period of rigorous practical training in the operation theatre, operation room, and in managing patients in various forms of surgery. However, it is seen that patients who are researching a hair transplant will still listen to the experiences of other patients who have been through this path on various social media platforms like YouTube, Instagram, Facebook, and many others. Well, this behavior is the same as reading biographies. We all are very fond of biographies because we wish to learn from the experience of others. A person who has undergone the same trials and tribulations like yourself adds a third dimension, which is emotionally laden and mirrors your daily struggles, your exasperations, and your anxieties about hair loss. And this is the third dimension that doctors fail to fulfill. The experiences of others, the dalliances with hair loss and hair restoration surgery has taught them to maintain a positive mindset in spite of adverse circumstances, to learn from their past experiences and move forward with a positive outlook. And these are the patients who advise patients who are researching a hair transplant. And many of these patients who have undergone hair transplants, long journeys of hair transplant, have turned mentors. But one of them is J International. J International is not a mentor, at least he's not a mentor yet. And today we're going to interview J International. J International will tell us about his many procedures, what were his struggles like, and what lessons he would give to a person who is researching a hair transplant today. Because there is no better learning than from the mistakes of others. Hello, welcome to my channel. So Mr. J International, would you like to tell my subscribers something about your struggles? You have undergone numerous procedures in hair transplant surgery. And I'm sure, like many others, you would regret certain decisions that you took that were born out of ignorance, hype, and excessive hope. And there were times when you felt that you were sold a procedure. Did this happen to you? So would you like to go back in time with us and recapitulate what decisions that you took were wrong and what you feel were right decisions? And if there were certain wrong decisions, and if you could go back in time, what would you rectify in your choices, in your decisions regarding those various hair transplants that you undertook over the years?
Now, in regards to your question, would I go back in time and tell myself anything different? Maybe, but what I really would need to do is have a time machine to go forward, because at the time when I had my first set of surgeries in the mid-90s, the state of the art was nothing like it is today. Really, they were still figuring out how to do hair transplants, and it was just a couple years removed from the worst of it when they were doing plugs. So if I could do something different, at that time I would have done nothing at all. That can be a hard thing to accept when you're young and you're balding and you see everyone around you having a full head of hair. But you have to realize that it could be a lot worse, and you can make the situation worse by having a bad hair transplant. So you have to always keep it in perspective that while losing your hair is not desirable, it really is not that bad compared to what a lot of people go through in their life. Given that, let's fast forward to the present. I had that first set of surgeries, but I've recently had a second set of surgeries because unfortunately I lost most of that hair due to progressive hair loss and poor surgical skill at the time. So what people should take away from this video is not that I had all these surgeries and I had this great result, that I had these surgeries and I had a bad result, and that this is the kind of things you should do and learn from me to avoid that type of outcome. So what I've learned now is that you really want a doctor who's entirely dedicated to hair transplants. They're not doing multiple different types of surgeries a day. They're doing liposuction in one room and they're doing hair transplants or Botox. Hair transplantation is their passion. That's all they do. Another thing you want to look for in a surgeon is someone has good reviews online, and nowadays we have the benefit of the internet, which I didn't have at the time of my first surgeries. So we have things like YouTube and forums. You want to find a doctor. It's clearly not just a business, but it's their passion, and they're eager to help people. Another thing you want to look for is a doctor who is not too aggressive with marketing. And that becomes clear that they're not promising you a full, thick head of hair like your original head of hair in a single session. They're going to look at your donor hair, be that on your body or your head, and then give you a realistic expectation of what you might be able to get. And eventually, yes, you might be able to get a great result, but it's very unlikely you'll get that in one session. And a good doctor is going to be honest with you about that. Another step patients can take is making sure their prospective doctor is a member of the International Association of Hair Restoration Surgeons or American Board of Hair Restoration Surgeons. These groups help make sure that doctors are maintaining a certain minimal ethical standard and have a set of skills required to successfully practice hair restoration surgery. However, as we know, the hair restoration industry is set with a lot of fraudsters and scams, so just because they have a seal from one of these on their website, you actually need to take your time, go to those original websites, and make sure said doctor is listed. The takeaway from this is that you've got to take your time and do your research, because while hair restoration surgery is simple in the scheme of surgery itself, it can be life-changing, and small mistakes can be very costly. So as I mentioned, I had a set of ill-fated surgeries in the mid-90s, but more recently I've had surgery here in Bangkok. And one of the things I looked for was the ability to speak directly with the doctor, and that the doctor was willing and available to answer all my questions. Another thing I looked for was photos that were high resolution and that I could use to verify their skill, and that they were using instrumentation up to the latest industry standard. Again, there's a lot of gimmicks and different names for things that sound similar but aren't quite the same in the hair restoration industry. And this is where you should go to the forums, talk to other patients, and get the general sense that this surgeon has a consistent, positive outcome from their happy patients.
Like you, many people today travel abroad for a hair transplant. Hair transplants abroad are attractive because they are affordable and many times of high quality. Many times people have not traveled abroad ever. What advice would you give them, especially because the consultation has been online, which lacks a human interface, an in-person consultation, and you know that nothing can replace an in-person consultation?
In regards to traveling abroad or even within your own country, having to first do an online consultation, all the previous that I said still applies. We live in a virtual world, particularly in the era of the pandemic, and we have to rely on things like Zoom and Skype, where we meet online. And you still want to see that you're not only speaking with a consultant, but directly with the surgeon, and that surgeon has time to satisfactorily answer all your questions to the point where you feel comfortable to move forward. Now, I personally do live abroad. I'm an American, but I live in Thailand, and I have benefited from the lower costs here in Thailand. Now, while low cost is important and surely attracts a lot of people to different surgeons, it's not the deciding factor. You have to make sure that they have the skill and the ethics to get the work done. Now, of course, if you can do that at a lower cost than your home country, well, that's a great benefit. So great skills and low cost, that's a perfect formula for a good outcome. So in different countries, the cost of labor, the cost of the equipment might be cheaper, and that's why your surgery is cheaper. That's a good reason. But if it's cheaper because the surgeon is inexperienced, well, that's not a good reason, and you should pay more to get the experience.
Young people like yourself, when you first underwent a hair transplant at an early age, will believe anything they are told. Their psyche is one of urgency and desperation, and this makes them very gullible. This gullibility can be self-destructing in the field of hair restoration surgery. As a mentor, Specs in his interview said that this industry preys upon unsuspecting individuals. Can you shed some light on psychologically how a young man feels when he starts to lose his hair? And what would you advise him?
Being young and losing your hair, that can be the hardest of all. Because most likely, most of your peers have hair, and there's no doubt that losing your hair can present some challenges in the dating world. And one of the first things I would do ironically, before getting hair restoration surgery, is feeling comfortable with your hair loss. Hair restoration surgery can be great. It can restore your confidence and, help you with women or whatever your goal is. But you got to get to the point where it's an enhancement. Because if you're looking at it as something that's just going to save your life and change everything for the better, I think you're mistaken, and that's where you're going to be susceptible to some of these predatory marketers in the hair restoration industry where they're more interested in your money than your happiness. Another mistake young people make, and I've made this mistake myself, is thinking you just want to restore your hair to the point where it looks good now. And when you're 40, 50, or older, you're not going to care anymore and it doesn't matter. That's not true. You need to understand that your hair loss might be progressive, that you may have limited donor hair, and it's almost like a chess game. You've got to be strategic about it, where you're getting the maximum coverage possible that your density allows, but at the same time, foreseeing that you may lose more hair and that it's going to look different as you age, and you may need subsequent surgeries to cover up your hair as your hair loss progresses, if it does. And I want to reiterate, while losing your hair is a bummer, always keep it in perspective. For example, let's consider Michael J. Fox. He was in the Back to the Future movies and a TV series, and unfortunately was stricken with Parkinson's disease. Now, he has a full head of hair now, but don't you think he would gladly give up all his hair to not have Parkinson's? So by all means, try to restore your hair, but always keep it in perspective that it's not the end of the world or the worst thing that could happen to you.
What are the red flags that a patient, while researching a hair transplant, should notice before he signs up?
Some of the red flags I would look for is a doctor who is not dedicated to solely hair transplantation. As I mentioned, they are doing multiple other types of surgery. Maybe they work in a dermatology clinic, and hair restoration surgery is a part-time or side gig, that they don't have experience, that they're not a member of these boards, and that they're too aggressive with their marketing and not in their results and their concern for you.
Well, there is a lot of talk about medications used for hair loss, medications used for hair transplant, medications used before a hair transplant, and medication used in the long term. Medications with stated side effects, medications without side effects, natural medications, and mechanical ways of growing hair. How was your experience with these medications, especially with oral DHT blockers like Finasteride and Dutasteride? Yes, Mr. J International.
On the topic of medication for hair loss, it's very important to consider that in many cases, even if you get a hair transplant, your hair loss may continue, and that can be slowed or even stopped with the right medical combination. So that's something you want to strongly consider. In my personal case, I did try a DHT blocker, Finasteride, and I very unfortunately did have what they call erectile dysfunction, and I won't go into too many details there, but it was reason enough for me to stop the drug. And instead I ended up taking oral minoxidil, which I have a prescription for. And in my case, I have a lot of body hair, and that actually can help body hair both on your body and your head. So that's working for me. But I actually might try Finasteride again. Maybe I somehow over time have overcome the negative side effects of it. And I say that because I recognize how important it is. And I've done all this work to get my hair restored, and I do not want to go through it again.
While talking to you, I came to know that you've had a lot of body hair grafts done. What has your experience been with body hair growth? How do you think body hair adds a new dimension to the field of hair restoration surgery?
My original surgeries were strip surgeries. That was all head hair, and that all fell out. I later had FUE in the early 2000s. When I had that, I had a combination of head hair and body hair. Now the problem was I didn't realize my hair loss was aggressive and progressive, and I ended up thinning on the sides of my head, and you can kind of see it here a little bit. See there. So obviously if this hair thins and is placed here, that's going to thin as well. So that's something you need to look out for if you're not going to be taking a DHT blocker. Now, I had this FUE in the 2000s, and in that one I had chest hair, abdomen hair, and leg hair. And interestingly, though I lost most of the head hair from that, I ended up retaining the body hair. I've been told paradoxically, while DHT can miniaturize hair on your scalp, it can actually increase hair on your body. So Ironically, having this body hair, putting it on my head, plus taking minoxidil, that might be a good formula for retaining that type of hair. Another thing to keep in mind about body hair is, from what I can tell, it's an entirely different set of skills. It may take a different set of skills to remove it from the chest, from the beard, and other parts of the body. So if you're gonna additionally get body hair, make sure that your doctor has an understanding of it and you're not the first person they're ever doing it on in some kind of experimentation where they may very well get it wrong.
And you've been studying FUE hair transplant, FUT hair transplant as a researcher for past so many years. How do you think as a patient that the technique of FUE has evolved over a period of time as you see it?
So I had FUE surgery in the early 2000s, and while I wasn't the first to ever get the surgery, I was early in its progress. Now, while I did have some success with that early surgery, I have noticed significant changes between then and now. One is the variety in punches and the caliber of the punches. I think in some ways, FUE was only a small step from the original plug type of extraction where they use these 4mm punches and basically cord it out of the side of your head and it just looked bad. So original FUE might have had a punch larger than 1mm and they may not have understood the best way to extract it, and as I mentioned, how to extract it from different parts of the body. Another consideration is, while FUT strip surgery will leave a linear scar on your head, FUE can leave scarring on the head as well, particularly if the doctor is taking the grafts too close to each other. The extraction sites can bleed together and make a larger scar than individually if they space them apart. So I see doctors today, for the most part, the good doctors, using good tools. Another advancement is FUE, it takes much longer to extract the hair from the head. And so either they need to place it right away or have some type of solution that's going to preserve this tissue. It's going to preserve the life of it so that by the time they get in your head, it's still alive and eventually going to grow. So what I've seen over time is refinement of tools, perfection of the process, and an end result that really today rivals strip surgery. Dr. Bhatti, thank you for those questions. Now I have a few questions for you. Now, while I've enjoyed your videos and learned a lot from them, I don't know a lot about your practice and your surgical process. So let's say I'm a prospective patient and I'm intrigued by your videos and I reach out to you. What is the process going to be like? So let's first talk about door to door and then day to day. And when I say door to door, let's say I'm in America, I want to travel to India to have surgery with you, but I'm really not familiar with the country. I don't know where to stay. I don't know what I'm going to eat. I don't know what it's going to be like working with your team. Can you walk me through door to door and day to day what the experience is going to be like?
Well, Mr. J International, as far as my clinic goes, my clinic's name is Darling Buds Hair Transplant Clinic, and it is located in my own building, which is Five Rivers Hospital. There are various other treatments. In the same building, my wife runs her Amulya Labs, which is engaged also in hair research work. And this is also where we prepare our platelet-rich plasma mixed with A cell. On the ground floor, we have a cosmetology center, which is leased out. But the hair transplant is done only by myself. And I am engaged 100% in hair transplant. I do not do any other procedure. Though I'm a plastic surgeon, I have done a lot of cosmetic surgery procedures in my lifetime. But after 2012, I have focused solely all my energies on FUE hair transplant surgery. And an advanced form of FUE hair transplant surgery, which we like to call as the anagen Q plus technique, which is a variation of the DHI technique, best suited to my practice, best suited to my team towards giving satisfactory results. And we've been giving satisfactory results for the past over 15 years now. My clinic stands out by the fact that we have only one doctor, that is myself, and we do not operate out of our Chandigarh center. We do not believe that opening branches all over the country or in other countries will help in furthering our objectives and our goals of providing effective, safe, transparent hair transplant procedures to our clientele. So therefore, it is a one doctor, one patient, one center, one team clinic, which we abide by and which we have been following for the last so many years. Whenever a patient reaches us, he can reach us either through email or through WhatsApp. When he reaches through email, he lands up with me. All emails in my clinic are replied by me, and I do not take more than 2 days in giving a reply because there are a lot of emails. Whenever you contact the clinic through phone or WhatsApp, the initial consultation is done by my counselors, but all the opinions about how many grafts are required, whether you are a candidate for hair transplant or not, and to recalibrate your goals and objectives with what can be achieved through hair transplant is done by me. However, all follow-up is done on WhatsApp. I'm available to do Skype conversations. You can tie up a video call slot by messaging my number 981-453-1111. Of course, Skype consultations before the procedure are paid, but follow-up conversations, be it video calls, be it WhatsApp, be it email, are not charged for life. Our response before and after hair transplant is very prompt. And when you undergo a hair transplant with us, you will notice that we do not take much time in replying to your mails or your WhatsApp messages. So it is a very in-person consultation. Whenever you land in India, if you land in Delhi or if you land in Chandigarh, the driver will come and pick you up, and we will arrange a hotel for you. We will arrange a stay for you, and for that you can contact us. There are various hotels and various places where you can stay. This all will be tied up by myself or by my office for you. So while you're interacting with us, there'll be a lot of interaction in person between you and me throughout the process of planning your hair transplant, during your procedure, and much after the hair transplant is over. Many of my patients I have been following up for 10 years, 15 years. And this follow-up is free of charge for as many years as you want.
Another topic that might be interesting is people are traveling all the way to India. Maybe they want to tour the country. Is there any other type of information you could give to patients who possibly want to maximize their time there, have the surgery, and then have a chance to tour around the country? Any feedback about that?
Most people recover for about 36 to 48 hours and travel back to as far away as North America or to Australia within 36 to 48 hours, and it's pretty safe. We have been seeing that for the last 15 years, that people traveling back to such great distances can travel back very safely because there is no swelling and no visible signs of the procedure that we do, because it is a minimally invasive procedure at our center. But there are many who would like to recover for a longer period of time. They have a choice of either staying back in Chandigarh, where they can have a prolonged stay, or they can go uphill, the foothills of the Himalayas. And we have a villa in a place called Kasauli, which is a favorite travel destination in this part of the country. And you can recover in our villa for as long as you want. Many people stay for 5 to 7 days after they have had their hair transplant with us, and you can do the same. We will guide you through the process and what all places to see. Many people would also like to go around seeing places of tourist interest like the Golden Temple, the Golden Triangle, and many of you would like to go and explore the beaches, the silver sand beaches of Goa. We have also in the past tied up hiking expeditions to Ladakh, that is in Jammu and Kashmir, where the patients take a bike trip through the passes of Ladakh territory and right up to the border. Tourism to places like Pangong Tso, tourism to places like Leh are encouraged by the Indian government, and you can go and visit so many parts which are beautiful in and around Chandigarh.
Dr. Bhatti, my second question is in regards to body hair and minoxidil. As I mentioned earlier, interestingly, it seemed like my body hair was the only hair that stayed on my head. And as I also mentioned, as I age, even though I have lost hair on the side of my head, my body hair tends to increase. Is there any scientific basis to this? And if somebody was a patient of yours and they had either only a body hair transplant or a combination of body hair and head hair, is there any type of difference in medicinal regimen you would suggest to them?
Well, as you suspect, it is rather ironic that though DHT has a negative effect on hair on the scalp in those who have the baldness gene, they do the reverse on body hair. Why? Because body hair, facial hair, genital hair is part of secondary sexual characteristics. Right from the time you achieve puberty, during your adolescence, and in your early adulthood, the secondary sexual characteristics are brought about by DHT. And DHT is the active component of testosterone. And as you all know from previous videos, 10% of testosterone is converted into DHT. Other male sexual characteristics like a deep voice, muscle mass, are also determined by the effect of DHT. So these are the areas of the body which are not affected by baldness. These areas are permanent. DHT has some amount of negative effect on the growth of body hair, but it is not so negative as on the scalp when the patient carries the male pattern baldness gene. So body hair, we can say, is relatively immune to DHT. May not be completely immune, but when DHT levels decrease, especially after the age of 35 to 45, we have seen that there is growth, a significant amount of growth and thickness of hair on the body, especially the face and the torso, that is the chest and the back. This is because the negative effect of DHT on body hair is somewhat reversed. However, the hair on the legs and the arms start to thin out and many times they get effaced with age. This is because of the effect of aging on these body regions. For a person who has had purely body hair, instances where a facial hair transplant has been done, example, a beard has been restored using beard hair from the shadow area. In these cases, mostly you do not need any DHT blocker and only minoxidil will take care of the growth process during the first 6 months. However, when there is a combination, which is usual, a combination of scalp, facial and chest hair to restore the baldness on the scalp, a DHT blocker is very essential, especially for the first 6 months after a hair transplant procedure.
Dr. Bhatti, I've really enjoyed speaking with you today, and I wish you and your patients the best of luck.
Well, thank you, Mr. J International, for being so patient and for accepting our invitation to discuss your lifetime experiences with my subscribers. Thank you very much. God bless and stay safe.